Hi, welcome back. I'm Dr. Patty.
Hi, Dr. Angela.
We are together again.
We are. We missed you guys together.
And we've missed each other. We haven't seen each other in a while. So we're happy to be back and doing videos together.
So true. So in this video, we're going to talk about what happens if you get an abnormal Pap smear. So, let's just talk about this process a little bit, because sometimes people don't even realize why we get Pap smears. And so one of the things we're looking for typically is to see if we have a virus called HPV. You can get an abnormal Pap smear even if you don't have the HPV virus. Sometimes there's a transient kind of inflammatory thing that can happen, like you have a yeast infection that's gone on too long, or bacterial overgrowth. Sometimes with an inflamed cervix, you can get an abnormal Pap. But more often, if you have an abnormal Pap, you might have the virus called HPV. And this is the virus that also can lead to warts, genital warts, but there are many strains of HPV, and often you can have a strain of HPV that's not associated with genital warts, but could still lead to cervical cellular changes and eventually cancer. And this is why we routinely get regular Pap smears once a year to make sure that everything's fine and we don't have these type of inflammatory changes happening. This is one of the things, as with a lot of sexual health questions, we tend to not talk about this area too much. And so I know a lot of women, when they get a positive Pap smear that shows HPV, there's a lot of shame, there's a lot of fear, and then there's also a lot of shame
and
that
confusion.
Goes with it.
I've had patients, a lot of times people take medicines, take pharmaceuticals, get Pap smears. They don't even know what they're looking for or why they're doing this. They've sort of been trained, okay, I go get a Pap smear once a year.
Yes.
And now it's abnormal. Now what? What does this even mean?
Exactly.
So it's not, it's not anything to be completely worried about.
Yeah. It sounds really bad, right? If you get a positive Pap smear that shows that you've got HPV, and we know this is a precursor for cervical cancer, this sounds like a really bad thing. And although we never want inflammatory changes and we never want to, move in the direction of a cancer, the good news is this is a very slow growing cancer. It takes a long time for cancer to even develop, and it is a slow growing cancer. And there's actually a lot we can do to normalize the cells of the cervix. So that's what we're going to talk about in this video. There's a lot of great, natural, effective, safe things you can try.
So one thing that you may not know is that if you get an abnormal Pap report, first of all, it's just looking at the beginnings of cellular changes.
Yes.
So this is why it's so important to get your Paps every year, because as Dr. Angela mentioned, cervical cancer is very slow growing. So a Pap is wonderful because it's going to look at the very, very beginning stages of a little bit of change. And at that point, we can really heal the body.
Yes.
And your doctor or your gynecologist may want to do something called a colposcopy.
Yes.
Which means that they just use a very special camera and use a little bit of acid dye and look very closely at the cervix to look for tissue changes and cellular changes. That gives a little bit more information than just the Pap. They can look a little bit more closely. And this may or may not include a biopsy.
Yes.
And later down the road, one conventional treatment for cervical cellular changes is something called a LEEP, where they actually, it's a little bit more invasive, and they do shave off a layer of cells and on the cervix. But this is, much later down the road, and there's a lot of other therapies that can be done in between.
Yes.
And we're going to talk to you about some of those things today.
Yeah.
And first and foremost is nutrition. So we talk about nutrition a lot, but it's it's something that you can empower yourself to do. You can start right away. And like many chronic illnesses and imbalances and things that happen in our body, really reducing inflammation is the name of the game. Yes. So in terms of what we're putting into our bodies, remove foods that cause more inflammation, like dairy, sugar, caffeine.
Sugar is really important because it also suppresses immune function. So this is a double whammy.
We want to really strengthen our natural immune defenses and our immune system.
Yep.
And sugar will kind of dampen that and turn that down a little bit. So as I was saying, remove sugar, dairy, alcohol, caffeine, and processed meat. So commercial meats that are not grass-fed or pastured and full of hormones and chemicals and pesticides. So you want to eliminate those, and really increasing your vegetable intake. So You want to do more beta carotene rich vegetables.
Yep.
And these are your vegetables that are going to be more orange and yellow. And beta carotene is a precursor, meaning it helps make more vitamin A in our body, but in a natural way, as opposed to putting vitamin A directly into our system. Beta carotene is a natural food-based form that helps convert in our body. And vitamin A, it converts it to vitamin A, which is really good as an antiviral and immune support, and just overall great for the immune system in general.
It also heals up mucosa, so all the type of tissue that's on your cervix, it heals that tissue up very well. Yeah.
And then you want to do more dark green leafy vegetables and green vegetables. You're going to get some folate through your vegetables that way, and you also want to get some zinc through your through your vegetables as well. And
and nuts and seeds, great source of zinc.
And if this is all just too much to remember, I would say just increase your vegetables.
So true. Take down the sugar, increase the vegetables.
You don't have to remember what every vegetable does and which vitamin I'm getting and all of that. So just go ahead and increase your vegetables and you'll cover all your bases. And in addition to other lifestyle choices and, in addition to what you're eating, make sure that you're not smoking, because smoking is very much linked with cervical cancer.
If you have HPV and you're a smoker, your odds of getting cervical cancer in a more expedited way are high. So it's a really big deal to work on eliminating smoking if you've had a positive PAP.
Absolutely. And along those lines, in terms of reducing inflammation, food and smoking, but also just your mindset and stress management. So however that works for you and whatever methods you have, we could be eating the most perfect diet, but if we're stressed, our body's going to create inflammation to try to put out that fire that we've created in our mind.
And you're also going to tank your immune system. So when we're stressed, we tank our immune system so we can't fight any cellular changes that are happening. And so sleep too. Sleep's another big deal, getting enough rest so that our bodies can heal up.
Absolutely. And what about in terms of nutrients and
supplements?
Nutraceuticals?
Yeah. So there are actually some very powerful tools that we can reach for if we get a positive Pap smear. So number one on the list, you wouldn't think, but folate. Folate is a really important nutrient for preventing cervical changes that lead to cancer. Green tea is another really heavy hitter. So you can, of course, drink green tea in your diet too, but you'd have to drink a whole lot of green tea. And so finding capsules of green tea is going to be a much more powerful therapy.
Or green tea as a suppository as well.
Yes, you can have your compounding pharmacy make those up with your naturopathic doctor or your integrative medical doctor. Those can definitely be made up and inserted every night when you sleep for a while, and that can really help. Vitamin A is another one. You can take beta carotene or you can take vitamin A, and it's very effective at healing up the cervix. DIM is another very helpful one if there are cervical changes. And then zinc and vitamin C, those are also very useful.
And I also, in my office, like to make up a antiviral, immune supportive herbal blend.
That makes a lot of sense.
So this may include herbs like Hypericum, golden seal, licorice, melissa is another one. Sometimes I'll also put some Berberis in there. So I'll often add that to a patient's protocol. So antiviral herbs to just help the immune system, and not only antiviral herbs to take orally, but you can work with your naturopathic doctor or your integrative doctor to have them help you make a prescription for an herbal suppository that you insert vaginally. And so it's putting some good healing herbs really directly on the tissue. So
and they can blend vitamin A, green tea, the rest of the antiviral herbs that Dr. Patty was talking about. So there's a lot of really wonderful things that can be done to help heal up our tissues so we don't have to go through more invasive procedures down the line.
And Dr. Angela and I have both worked with many patients who have abnormal Paps of different stages, and the body is very dynamic. And sometimes lab tests are a little bit scary because it's a snapshot, and you have to remember that our body is constantly in flux and we're organic creatures and things are changing all the time. So just the way that things can trickle down towards illness, we can also reverse pathology, and our bodies are fully capable of healing. Otherwise, we wouldn't be doing what we do.
This is very true. Yeah, so a lot of hope that this is very manageable, even though at first it sounds like a very scary thing, that this is often very treatable without any bigger interventions down the line. So give these things a shot. If you've had any diagnosis like this, or if you know somebody who's had a diagnosis, share this with them. This may be very helpful for them.
And work with your gynecologist, integrative doctor, and or naturopathic doctor to make a customized treatment plan in terms of dosing, and they'll have a better idea in terms of future scheduling.
Yes.
Some gynecologists will want to do follow-up Paps maybe every 3 months. That's fairly common. And you can have your doctors monitor your health and how you're doing. So work with someone that you trust and give these treatments a try, and they are very effective. So let us know in the comments below if you've tried any of these, what your experience with abnormal Paps have been, and feel free to share, and don't forget to subscribe to our channel, and don't forget to hit that notification bell button, and you'll be notified when we upload other videos. And let us know if there's other topics that you want us to discuss or you have questions about, and we'd be happy to share.
Absolutely. And I was just going to chime in with also, for those of you who have had success stories of reversing your abnormal Paps with some of these treatments, share them just to give others hope that this is indeed very possible and true. And with all of what Dr. Patty said, if you want to hear from us on a regular basis and get free tips, just sign up, subscribe, and we'll see you back here next week. Thanks so much.